Hey there, everybody, and welcome to this book review by Dr. Dawn-Elise Snipes. Today, I'm going to be talking about ACT Made Simple by Russ Harris. And ACT stands for Acceptance and Commitment Therapy. And y'all know I am a big fan of this theoretical approach to counseling, so it's not a surprise that I really love this book. If you want to take a look at the book, you can save 25% on it and your entire order by using the promo code 1168 SNIPES, that's 1168 SNIPES, at newharbinger.com. So what's awesome about this book? Well, the whole thing, basically. But when you get this book, it is written in a manner to help the clinician figure out how to best implement acceptance and commitment therapy. There is an introduction to the basic principles of acceptance and commitment therapy, including cognitive fusion and diffusion. And he talks a lot about the importance of functional contextualism, that is, behaviors that are functional and helpful in one context may not be functional and helpful in a different context. And it's important for people to be able to differentiate between those in order to live their happiest, healthiest lives. He goes on to talk about ways to conduct assessments in order to conceptualize cases in an ACT framework. With that ACT framework, we are really considering that functional contextualism. We're looking at the behaviors like addiction or depression or anxiety and the associated behaviors, and identifying in what ways is this functional to the person in what situations and what other behaviors might be more helpful. He moves on to talk about how to help people identify what is important to them in creating a rich and meaningful life, and then how to set goals to do what he calls living in the and. And these are really basic premises for acceptance and commitment therapy. ACT asserts that we all want to live a rich and meaningful life, and life inevitably involves pain occasionally. It's important for us to know what's important in our lives to make it rich and meaningful, so we can use our energy to move towards those things. Living in the and is exactly what it sounds like. We are able to live our happiest, healthiest selves and accept that there is pain occasionally. Finally, he moves on to specific techniques to increase skills to be more present in the current moment and mindful of what's going on. In order to engage in acceptance, we have to know what's going on. Then we can move to accepting it is what it is, dealing with the stress, expanding our awareness of what's going on and what's important in our lives, because sometimes when things start to go bad, we focus on that one thing. And he talks about how important it is to expand our awareness to everything that's going on and not just focus on the negative. And finally, he provides an acceptance toolkit to help people use that information about what's going on and the distress and what's meaningful in their life to create the happiest possible solution. It sounds complicated, but it really isn't. It's really very practical and very straightforward, which is another thing I love about ACT in general. My favorite parts of this book are the fact that there are tons of worksheets and activities for people to do. Now, when I read through this book, would I necessarily use it for bibliotherapy with a client, just give it to a client and let them take it home and go, good luck? Or for self-help? Yeah, maybe not. It depends on the educational level of the client. However, it is an awesome, amazing, fabulous resource for clinicians to use, and it'll give you lots of ideas about how to implement ACT with your clients. There are many different metaphors in the book in order to help clients understand the principles. I know I have difficulty sometimes coming up with analogies and metaphors to help explain sort of a diffuse topic to clients. And in the book, Russ Harris has done that for you, and he's provided a lot of metaphors that you can use to make the psychoeducational part really easy. And finally, he uses a lot of vignettes, which is not something you see in a lot of books. and it's really, really helpful, especially in trying to break it down in a short period of time. But he uses a lot of vignettes to help the clinician or whoever's reading the book see exactly how the technique should work. So it's a discussion between a client and the clinician. Those are probably my favorite parts of the book. Like I said, I really like this book itself, and I would highly recommend it if you are interested in acceptance and commitment therapy, or maybe you don't even know anything about acceptance and commitment therapy yet, but you do tend to use a lot of cognitive behavioral techniques. This would be a great addition to your toolbox.